Hello everyone, in this video I am going to talk about thrombocytopenia and different mechanisms involved in it. Coming to the types of thrombocytopenia, the first one is congenital thrombocytopenia, acquired thrombocytopenia, congenital platelet function disorders, and acquired platelet function disorders. There are four different mechanisms involved in thrombocytopenia. The first one is going to be decreased production, followed by platelet consumption, platelet sequestration, and increased destruction. Finally, we should never forget about pseudothrombocytopenia because it is caused by in vitro sampling errors. It can be caused by clumping of platelets in the sampling tube itself. So, if we are using automated cell count, that machine cannot differentiate a platelet clump from a true platelet. So, it will not count the platelet agglutination. So, your results will come as thrombocytopenia, which you might have to further recheck with blood smear examination. Usually in blood smear examination, you will be able to see platelet clumps towards the periphery of the smear. Anticoagulants such as EDTA can also cause platelet agglutination. So you can use citrate tubes instead of EDTA to check for platelet numbers. Breed-related platelet problems are quite common. For example, Cocker Spaniels are known to get immune-mediated thrombocytopenia, and coming to Greyhounds, they always have low platelet counts, which is normal for them. They have genetic predisposition, and also low platelet count doesn't mean that platelet function is compromised. So now let's begin with platelet destruction. Only in two specific ways platelet can be destroyed. Either a cell eats the platelet or it is destroyed by immunity. Coming to immunological reasons, antibodies are produced against glycoprotein 2B and 3A on platelet surface. This always happens because of loss of tolerance, which means your immune system is so confused that it doesn't know which is you, which is not you. Coming to the cell-eating platelets, mononuclear phagocytic system is very important in platelet destruction. Macrophages have huge appetite. They keep engulfing abnormal cells or the signals sent against that particular cell. So it always engulfs those cells and it will just destroy them. And coming to primary immune-mediated thrombocytopenia, we have already spoken that Cocker Spaniels can get these problems. So in animals, this can occur as a sole hematological disorder, or most of the time it can occur in addition to underlying condition such as Evans syndrome, immune-mediated neutropenia, systemic lupus erythematosus, etc. Only 5% of dogs can get primary thrombocytopenia. Other immune-mediated thrombocytopenia can always be secondary due to infection. I want to focus more on this point because most of the vets think that this dog is having primary immune-mediated thrombocytopenia, but it is not true because the incidence is very low and it is quite uncommon. So coming to secondary causes of immune-mediated thrombocytopenia, infection and inflammation play a very important role, followed by tumor. This commonly happens in paraneoplastic syndrome. Vaccine-induced thrombocytopenia is also possible. I just found this clinical study from Journal of Veterinary Internal Medicine in 2012. It was conducted by Purdue University. This study failed to demonstrate an association between idiopathic immune-mediated thrombocytopenia with the history of recent vaccination in dogs. But however, it is not completely impossible because this study was conducted only in small population. And coming to the other reason, transfusion reaction can cause immune-mediated thrombocytopenia. It is often called as post-transfusion purpura. Occurs 10 to 14 days post whole blood transfusion. Results in formation of alloantibodies against host's platelets. Antibiotics and drugs can also cause immune-mediated thrombocytopenia. Drugs such as methimazole, which is an antithyroid drug commonly used to treat hyperthyroidism in cats, and commonly used antibiotics such as sulfonamides. Infectious agents such as Rocky Mountain spotted fever, leishmaniasis, babesiosis, ehrlichiosis, and transfusion-related things like post-transfusion purpura. All these things can cause secondary immune-mediated thrombocytopenia. PTP is often reported in dogs with hemophilia A after multiple blood transfusions. Coming to decreased platelet production, genetic causes such as mutation in beta-1 tubulin gene, commonly seen in Cavalier King Charles Spaniel, is very common. If the thrombocytopenia is due to drugs which causes decreased platelet production, they usually go and attack the bone marrow hematopoietic stem cells. Drugs such as griseofulvin, phenylbutazone, carboplatin, estrogen excess, chemotherapeutic drugs and radiations can cause decreased production. Viral infections like FELV, FIV and ehrlichiosis can also cause decreased platelet production by attacking the bone marrow stem cells. Several bone marrow disorders like aplastic anemia, bone marrow myelopathisis, metastatic bone cancers, lymphoma, leukemia, plasma cell tumors can cause these problems. And canine cyclic hemoptysis is an inherited disease. It is often associated with mutation in gene AP3B1. It results in defective production of blood cells by bone marrow stem cells. And finally, coming to the platelet consumption disorders, the first one is going to be disseminated intravascular coagulopathy, and second one is rodenticide poisoning. And infectious agents such as histoplasmosis, dihydrofilariosis can cause secondary DIC, and hemolytic uremic syndrome, where it is accompanied by hemorrhagic gastroenteritis followed by thrombocytopenia and anuric renal failure. Placement of transvenous or transarterial coils can also cause platelet consumption. Snake bites can cause thrombocytopenia, which is commonly called as venom-induced thrombocytopenia. Most common causes of platelet sequestration are splenomegaly and splenic tumors such as hemangiosarcoma and splenic portal hypertension. Going to the multifactorial or unknown causes, neoplasia is most common cause. Intra-abdominal tumors such as hemangiosarcoma, lymphoma, carcinomas can cause platelet reduction. In a study, 75% of dogs and 10 to 30% of cats with hemangiosarcoma had thrombocytopenia. Infection with anaplasma platis can cause cyclical thrombocytopenia in dogs. Other things such as heat stroke, infective endocarditis, hemobartonellosis, and microangiopathic disorders such as DIC, etc. These things can cause thrombocytopenia as well. So these are the important mechanisms involved in thrombocytopenia that you need to remember. My next video will be focused more on platelet function disorders, both acquired and congenital. Make sure to subscribe to my channel for more such videos. I will see you in another video. Till then, take care and bye.